I love giving back, and I'm not a clinician, so I don't have that joy. The joy is that I like to say I take care of the people who take care of people. It's generally accepted that if you have a high percentage of Medicaid and you have a high percentage of uninsured, that becomes a safety net. As a safety net, we also deal with a lot of patients who have a complexity of issues, generally what we call the social determinants of health. So they might be food insecure, housing insecure, transportation insecure, and so it makes it much more complex. On top of the fact that we don't get enough money to pay for their care, I like to say anybody can fix a broken arm. We fix a lot of other broken problems that mostly derive from the social system that we don't have. I'll tell you a story. A two-person family, a husband and a wife, told me the other day that right now their premiums are $900 a month. Their premiums January 1st will go up to $3,800 a month. Because Congress and the President have failed to act to continue them, the tax credits go away, and what will happen in the marketplace is that people who are healthy will probably say, I can't afford that $3,800. They'll become uninsured. Things happen to them when they're uninsured, and they end up in the emergency rooms of hospitals. And so the prices go up. We call it a sort of the death spiral in insurance, and it just makes it unaffordable for the people that remain in. If you're seeing a doctor on a regular basis, they're monitoring your blood pressure, they're looking at your glucose, they're making sure you have eye exams. If you ignore all those things because you can't afford to go to a doctor's visit for your primary care, you're going to have aggravated health conditions. And that means not just that you're going to end up in the ED, but you might not be able to go to work. You might not be able to have good quality of life. And so it's not good for society that people are uninsured, as well as the costs that end up falling on the hospital. Healthcare in America is a mess. It's just a mess because we have haves and have-nots. And as a consequence to haves and have-nots, we have huge disparities in people's health care. What worries me is that we're just going to have people that aren't going to take care of themselves or be able to take care of themselves, because the people that lose Medicaid are not going to go buy insurance on the exchange for the most part. If it's $3,800 a month, that's more than the income limits for Medicaid, so they're not going to have insurance. I think it's a sense of community and what our responsibility is as citizens, and that means reducing crime, reducing homelessness, reducing the mental health and substance use problems. We don't take care of everybody equally. We need to take care of people in a compassionate way.